Our group will be presenting targeted therapies specifically on monoclonal antibodies.
Why are targeted therapies important? To put them in perspective, we need to look at the limitations of conventional therapy. These are expressed as tumor resistance, severe systemic toxicity, and narrow efficacy. Of all these limitations, perhaps the most important is that of severe systemic toxicity. Why does systemic toxicity occur? Systemic toxicity occurs because conventional cytotoxic agent attacks both normal and cancer cells equally. The attack on normal cell is what is expressed as severe systemic side effects. How are these toxicity expressed? The toxicity is expressed as hair loss, mucositis, damage to the lungs, damage to the nerves, damage on the bone marrow, which is expressed as myelosuppression, as well as cardiotoxicity. As a result of these limitations and these side effects, there is a need to design more selective drugs that attack cancer cells. These agents that selectively attack cancer cells are known as targeted therapy. Hence, they are agents that specifically attack survival-dependent pathways to suppress or kill cancer cells with little or no damage to normal cells. There are various examples of targeted therapy, as you can see. However, for this video, we will be limiting ourselves to therapeutic antibodies. Specifically, we will be looking at two types: the antibodies that are naked and the antibody-drug conjugates.
First, we'll talk about the naked antibodies such as trastuzumab or Herceptin, which is used for the treatment of breast cancer. Herceptin is a humanized monoclonal antibody which is formed by grafting parts of the murine antibodies into human antibodies, forming the humanized monoclonal antibodies, which are generally considered safe. Herceptin binds to the HER2 receptors, leading to cell death. Overexpression of HER2 receptors can lead to cell proliferation and cancer. As we can see, the HER2 receptors are overexpressed on the cancer cells, on the breast cancer cells, more than on the normal cells. So interfering with these receptors through Herceptin can lead to higher selective toxicity towards the cancer cells.
So what are the mechanisms of action of trastuzumab? It kills the cell by inducing apoptosis and stimulating the immune cells. It also inhibits angiogenesis, G1 phase of cell cycle, and decrease signaling by inhibiting two main pathways, which is MAPK pathway and PI3K pathway.
There are some challenges that face trastuzumab. First is the side effects. Although HER2 receptors are overexpressed in the cancer cells, they are still expressed in the normal cells. So interfering with these receptors through trastuzumab can lead to side effects such as cardiotoxicity, which is observed with trastuzumab.
On the other hand, resistance also is a main challenge faced by trastuzumab. Low response rates was found within 9 to 34%. Mechanism of resistance happen when there is a change in receptor-antibody interaction and increase in cell signaling.
Antibody-drug conjugates improve selectivity, reduce toxicity. MMAE is a poorly selective and highly toxic cytotoxic agent that attacks cell lines not expressing CD30 antigen and is banned from clinical use. After conjugation with anti-CD30 antibody, however, MMAE activity against cell lines not expressing CD30 antigen is reduced 300-fold, and its toxicity reaches tolerable levels as a result of this improved selectivity.
Brentuximab vedotin is the example of antibody-drug conjugate. It is formed by an antibody conjugated to a cytotoxic agent via a chemical linker. It is used in the treatment of classical Hodgkin lymphoma and anaplastic lymphoma after failure of combination chemotherapy regime. This is brentuximab mechanism of action. MMAE that is attached to anti-CD30 monoclonal antibody via a stable linker will tracks down and binds to CD30 antigen, forming a drug-antigen antibody complex, which is then internalized via endocytosis. Endosome is trafficked towards cytoplasmic lysosome to cleave the drug-antibody linker. MMAE is then released after the cleavage and binds to tubulin, and will cause tumor cell undergo G2M phase cell cycle arrest and apoptosis.
Antibody-drug conjugate limitations. Not all compounds that can benefit from conjugation are able to be chemically linked. Also, the process of internalization is inefficient. Thus, only compounds which are still efficacious at low concentrations can be used. Lastly, non-specific uptake of ADCs via pinocytosis causes toxicity due to off-target effects.
In conclusion, MAP's proven its benefit to patients in terms of response, survival, and quality of life.